in your opinion, is the government doing enough in this score? And what are you doing to get the private sector involved? Because after all, you know, a lot of their employees, thousands of them, are at risk, I think.
Right. What is enough? I mean, the government's task is to provide the leadership, to provide the policy environment, the regulations. That basically, yes, that's not enough. I mean, but a lot has been achieved since 2006. It's the implementation that's very important. And the implementations, I have to say, we have achieved a little bit of progress, but we still need more resources to be able to cover this country, which is so huge. But we do have a good strategy. We do have a good action plan. We have already mobilized resources. It's not yet enough, but yes, we do, from the Global Fund, from the Partnership Fund, also from local resources.
Private sector?
From the private sector also. We have the Indonesian Business Coalition Against AIDS, of the big, especially the big companies. I said, you don't have to give me money, but make sure that none of your employees are infected. Okay, so prevention program. And secondly, that those who are infected do not get discriminated against, that they can stay employed and work and get access to the support and treatment that they need. Private sector, they should take care of their employees first, because that's where the danger lies. If the productive age population is infected, then we'll be sorry, and the businesses will be sorry.
Right. You spoke about discrimination against people afflicted with AIDS. What is being done to eradicate the stigma that is attached to HIV/AIDS problems?
Actually, it does not only stigma against people living with HIV. That has decreased a lot now, since people understand what is HIV, how does it spread and all that. My concern at the moment is stigma and discrimination against the people who are vulnerable. For instance, injecting drug users. If they are considered criminals, the stigma that they're criminals means that they cannot have access to services. The same goes to men who have sex with men, or transgenders, and female sex workers. Of course, they're all stigmatized and marginalized. And that is why what we're doing now is supporting them so that they can form networks. They form networks. We now have network of people living with HIV. We have people of injecting drug users. We have men who have sex with men, the networks of men who have sex with men, as well as transgenders. It's not easy. The organization of sex workers, it's not easy, but one of the ways to get them empowered is through forming these networks, these organizations, and then we support them so that they can take care of their own members.
Well, what is being done to change the attitudes of some leaders in society who are against this, who have a different viewpoint from you?
A lot. A lot. Whether they want to listen or not, we tell them that these are our people. These are our people who have the right to live. They have the right to health. They have the right to economic opportunities. And that the stigma and discrimination is against the law. We do have the law, the human rights law, but it is a belief in community that's very hard to change, and we just have to live with it. I mean, we try to change that, and some do change.
Well, what do you say to some religious leaders who say that this is against the religion?
We then said, yeah, like for instance, condoms. I've had demonstrations and all that by people who don't like us to talk about condoms, not only religious leaders, but also groups in the community. And we said, okay, look, first of all, our national strategy stipulates that the first approach is religion. And so only to those that do not engage in their religion, who engage in high-risk sex, those are the people we target with condom promotion. If they're already in church or in or they do whatever their religion tells them to do, then they don't need condoms.
They're less likely to be vulnerable.
No, they don't. They don't need condoms, and we don't even promote condoms for them. Why should they? But for those who are at risk, the young people who don't know that what they're doing puts them at risk, or those people who engage in high-risk sex, we do have the data, we do have the evidence that it's millions of people. They have the right to information, and we have the obligation to provide this information and the services to them.
Now, you have been quoted saying, I know that you are a very outspoken proponent of women's issues, and you said that we need more women leaders in the fight against HIV.
My friend, we need more women leaders in all aspects. Yes, indeed, because my experience in the past, long years, many years, is that if a woman leader is convinced of a cause, she would do a lot of things, and she can make things work. I am not saying that the men don't, but I have seen how women work from the highest level to the most even illiterate women leaders, that once they are convinced of a cause, boy, they can move the earth to be able to achieve that. And I have many years of experience in that.
So our hope lies in women.
Both men and women. Okay. I'm a gender person, so
all right.
I know that both men and women, we have to share this planet. We cannot live alone. We cannot live without the man, and neither can the man live without us.
That's true.